It is wonderful to see so many of our dear friends, donors, and partners join us today for this very special and exclusive WebEx providing an update on the new HonorHealth Neuroscience Institute. Today, you will learn from two of our top experts, Dr. Fred Marciano and Dr. Todd Levine, on the incredible vision of the HonorHealth Neuroscience Institute. In your confirmation email, you all received the biographies of our esteemed physician presenters, comprised of Dr. Frederick Marciano, Chairman of Neurological Surgery at HonorHealth Scottsdale Osborne Medical Center and Medical Director of Neurosciences at HonorHealth, and Dr. Todd Levine, HonorHealth Neurology Medical Director. I do hope you have had an opportunity to familiarize yourself with the accomplishments of these incredible leaders. Also joining us today to inform our discussion is Kelly Jackson, who serves HonorHealth as the Associate Vice President for the Neuroscience Service Line. You will be hearing from Kelly shortly. We also have several HonorHealth Foundation leadership staff here with us today on this WebEx. Jared Lankilde, President and CEO, HonorHealth Foundation. Joanne Gain, Senior Vice President, Major and Planned Gifts, HonorHealth Foundation. Jan Miller, Brenda Solomon, and Deborah Rittenhouse, all Vice Presidents, Major and Planned Gifts, and Pat Elder, our Vice President for Planned Giving. Please know we are all here to serve you in the important work you do in supporting our organization. From all of us, I'd like to thank you. Before we get started, I do have a few housekeeping items to go over with you. First, please take a moment to check that both your video and audio are muted. Also, we have allotted 15 minutes at the end of this presentation to answer your questions. To submit a question, please use the Q&A feature on the right-hand side panel of your screen. Please do not use the chat feature, as we will be using the Q&A feature to moderate questions. Lastly, should today's presentation inspire you to learn more about the HonorHealth Neuroscience Institute or HonorHealth Foundation, please connect with your contact here at the Foundation or give us a call on the main line included in your confirmation email. Support from people like you, those who understand the importance of having strong health care, make our work possible, and we stand ready to assist you in bringing your generosity to the front line. With this, I'd like to turn over the program to our esteemed experts. And first up, we will hear from Kelly Jackson, HonorHealth's Associate Vice President of Neurosciences. Kelly?
Thank you, Ashley. Good afternoon, everyone. Wanted to thank you for joining us today on behalf of Dr. Marciano, Dr. Levine, and I. We are very excited to be here to speak with you. If you please go to the next slide. I've been with HonorHealth for 14 years, and this is a very exciting vision that we've all been working hard towards. Next slide, please. Before beginning with Dr. Marciano's presentation, I wanted to provide an update on this project. Can you please go to the next slide? As you can see on the video, on the right-hand side is actually a live picture that was taken this week from our video cam of the site. With the construction progress. It's going up very quickly. You can see in the far distance, that's Honor Osborne there, that's slowly becoming smaller as the days go on with this getting built. On the left-hand side, you can see the location the building's going to be at off of Brown and Osborne, right next to Honor Osborne. The construction continues to progress very well, even given the current pandemic state during COVID-19. Significant precautions have been in place, and we've been able to maintain our schedule. We plan to see our first patient by mid-May of 2021. We believe that our final beam to be set for this building will happen by early June, and we're very excited about this progress. Next slide, please. Our vision with this building is really to create a multidisciplinary neurologic care model here in Arizona. And how we do that is by partnering with the best clinical experts, research leaders, and care teams to drive the best outcome and processes for our patients. And we can't do that without you and without your support. So we really appreciate you taking time this afternoon to learn a little bit more about our vision for our community and how we can help support each other. So with that, I'd like to turn this over to Dr. Marciano, who will give you a deeper dive into our neuro model as a whole for HonorHealth and our mission that we're looking to accomplish. Thank you so much.
Good afternoon, everybody, and Thank you for joining us on our WebEx today. It's become sort of the standard of way we're delivering healthcare these days. I've spent a lot of time over the last several weeks in front of monitors, having teleconferences and telemedicine visits with all of our patients. Unfortunately, it's become somewhat of the new norm. So again, we welcome you and hope that you gain some clear insight into our program and where the future holds for HonorHealth Osborne and the neurosciences. If I can have the next slide, please. What we'd like to do is first start with what's the mission. The mission for all of us has always been to try and provide the best care for our patients. We found that over the course of the last 20 years, that care has become more and more challenging to deliver as healthcare becomes more complex, and in particular, the neurosciences become more complex. When you have a diagnosis of a neurologic disorder, it can be incredibly daunting and incredibly scary. And so what we're trying to do through this process of integrating all of our care under one roof is to try and make that possible for you to be able to enjoy all of the services that HonorHealth has to offer, including all of the professionals as well as all of the associated services necessary to provide you the best diagnosis as well as treatment for any condition that you may encounter in the neurosciences. And we'd like to do this all under one roof, and we'd like to be able to take you from diagnosis to treatment in a very smooth fashion that's efficient and provides not only the patient but the family members the highest level of engagement. If I can have the next slide, please. Let's start with, I want to start with just the neuroscience service line in general. If you look in the center part of this, our goal is to take care of our patients in the HonorHealth community as well as the surrounds. And if you look in the pink portion of that is really where we started our journey, which is more the inpatient aspects of our care. Our group started in 1997 here, really as traumatologists to take care of the trauma program. But as we engaged with HonorHealth over the years, we've been able to grow that to include the management of brain tumors, the management of aneurysms and stroke. And now we have some world-class gentlemen who can work treating stroke and stroke care. Movement disorders, including Parkinson's disease. We now have deep brain stimulation available on our campus. We have all full complement of spine management and spine-related disorders we can care for, from tumors to the spine to degenerative diseases of the spine, as well as dementia and concussion and other aspects of neurosciences. So we started that in the late 90s and have matured that process to the point where we have really nothing that can't be offered here that is available to everybody at a moment's notice. And through our trauma program and through our inpatient services at Osborne, we've been able to accomplish all of that. The thing we were missing was really the outpatient aspect of this. When we engaged the HonorHealth Neurology Group, at that time Phoenix Neurology, we've been able to start talking about what can we do in the outpatient setting, so that when you have a diagnosis of a neurologic disorder, where can you go and where can it be treated, and can it be treated efficiently? The green aspect of this neuroscience service line really shows the vision of the Neuroscience Institute, where we will have multidisciplinary neurology clinics. We'll have all aspects of neurosciences, from neurosurgery to neurorehabilitation to neuroendovascular and stroke care, all contained within this facility and available to have diagnosis and treatment in an efficient way. In addition to treating the clinical aspects of this, we also have to treat the psychosocial aspects. So looking at nutrition services and physical therapy, infusion services, case management are all become a very important part of what we do and when you take care of a patient who has a neurologic issue. Really important here is the nurse navigator, having that person who can take you through our institute from your diagnosis, get you into the right offices, get your care coordinated in a way that limits the frustrations that tend to come with trying to navigate a healthcare system and trying to do this all under one roof. If I can have the next slide, please. So why are we doing this? I think that Dr. Levine and myself can comment on this, as well as all of the patients and patients' families that are sitting on the call today. There's a tremendous frustration that comes when you have a diagnosis of any entity, particularly a neuroscience diagnosis. And where do you go? Where do you start? How do you navigate the system? Who do you engage? And I think that's what really has driven us to be able to develop this mission. We were frustrated with our inability to be able to coordinate care, our inability to have us working together cooperatively. This facility, I think, will allow us to do that. We can integrate neurology, neurosurgery, physical medicine, rehabilitation, therapy services. So hopefully at the end of the day, we'll have a better patient experience. And when you have coordination of care, you can anticipate better outcomes. And that's really our goal, is to provide the best outcome for all of our patients. Obviously, in this day and age, cost management is important, and with coordination of care, not having to reduplicate testing, et cetera, will allow us to be able to do this in a cost-effective way. The other thing I think we need to emphasize is this center will also do research. Research, I think, is an important part of what we do to provide you the 2021 healthcare, not just last year's model, but this year's model, and any future research protocols, et cetera, will all be able to be done through here. Dr. Levine and his group, as well as our group, currently have a number of research protocols in all aspects of neuroscience care, from movement disorders through to thrombectomy and stroke care, as well as brain tumors and spine care. So all of that is available to you, and we hope that we'll be able to provide that in a more comprehensive way. If I can have the next slide. So again, areas of care will include everything from ambulatory care to surgical to medical. All the services are listed there. One of the things that has been really a big boon for this campus was to have a conference space. And so that will really allow us to be able to integrate not only our physician researchers and collaborators, but also have opportunity to be able to have community conferences and be able to talk about your diseases and how we may be able to help in a better space that's more friendly and inviting. Hopefully we'll be able to do that someday in face-to-face, and it's not going to be all through computer monitors, but we can only pray. The BioSkills Laboratory, part of our mission is to also train future physicians and surgeons, and a BioSkills Laboratory is something that I really stressed as an important part of our mission, to train the future of neuroscientists to be able to provide care beyond our program and beyond our walls, but also to reach the community, both locally, nationally, and internationally. And I think we can do that through our research and through our laboratory services. And then there's no aspect of neurosciences that won't be covered. That'll include neurology, neurosurgery, physical medicine, and rehabilitation, as well as neuroradiology. Also importantly, we are looking towards neuro-oncology, dementia researchers and dementia physicians, all in one center, so that if there is any aspect of a neurologic disorder that you encounter, we'll have it available to you, and we'll have it available to you all in one space. Next slide. I'll introduce now Dr. Levine, my colleague and friend, who will give us sort of the human touch that's going to come out of this entity.
Great. Thanks, Fred. And thank all of you for joining us this afternoon. As Fred said, it has become all too normal very quickly to spend my entire day looking at a computer screen and not actually seeing another human being. I decided this week I actually like people, maybe why I went into medicine a little bit, so I miss seeing people. Anyway, I wanted to try to lay out a little bit sort of a slightly different way to think about what we've been building here. And I think what Kelly briefly mentioned, and Fred didn't mention too much, is that Fred Marciano and I really began to think about something like this, I think now 10 or 12 years ago. And so this has been a very, very long process, and really he and Kelly and Donna Sells deserve a lot of the credit for kind of sticking with it. I came in, left, and now I've come back to kind of help get them over the finish line, I guess. But in a lot of ways, I think what Fred was also talking about, and especially in neurology and neurosurgery, is that everything has become so specialized and so complicated, and so that you have a doctor for dementia, you have a doctor for Parkinson's, and 30 years ago there was just a neurologist who treated everything, and in large part that's great. That is because there is so much research that's going into these diseases, and that hopefully we will have better treatments and better cures shortly. But in a lot of ways, it's led to what Fred also mentioned, which really has been a big fragmentation of healthcare. And I think that's true across the board. And as I sort of think about this, I think that, with the explosion of science over the past couple of decades, everybody has thought about treating a disease. And unfortunately, what happened in that was that people forgot about the fact that we actually cared for people. And there's actually a big difference between treating a disease and caring for people. And what we are trying to do in the Neuroscience Institute is to be able to do both of those things. So as Fred mentioned, I think we now have at HonorHealth and with Barrow's Brain and Spine more neurology and neurosurgery research trials than any other entity in the Valley. So more than Barrow's, more than Mayo. We're doing tremendous research here at every level. And so we want to continue that, and that has to be sort of the pinnacle of what we're doing. We have to be the place that people recognize as having the best research and the best clinicians, and I think we have that, which is what's so amazing. But then we want to be able to couple that with the idea of caring for people in a very different way. And so not the idea of coming to a doctor office, seeing that doctor and leaving, and then trying to figure out how to manage all the pieces that go into that disease state and that family and that patient, but really providing that all in one place and making it accessible and easy and a part of just the care that we provide. So I thought I'd just do that just by highlighting just a few cases. If you go to the next slide, just in terms of how complex these types of diseases are. So I have spent about the last 25 years specializing in Lou Gehrig's disease, or ALS, which is a terrible disease. It usually affects relatively young, healthy people. And so this was a 65-year-old who 9 months ago began to notice that when he walked, he would kind of stumble over his right foot. Within a couple of months of that, he began to notice that the whole leg was weak. And then within a few months of that, began to notice that the hand began to get weak. He came in to see us, and after doing the appropriate testing, we realized that he had ALS. In the last few months, the weakness has gotten worse, so that now he has trouble speaking, he has trouble swallowing, and has begun to notice some difficulty with shortness of breath. So there are a lot of problems here that we have to deal with. And unfortunately, with a disease like ALS, we don't have a treatment yet that is really effective for these people. Next slide. But just because we don't have a treatment doesn't mean that we can't care for him and care for his family and that we can't improve his quality of life. So what does that mean? Well, number one, we have to make sure that we do what we can to help with his walking. So we don't want him to fall and to have another injury. So we need people to assess him and to say, does he need ankle braces? Does he need a wheelchair? Does he need a walker? That is not done best by doctors. That is done best by physical therapists who have trained to do that. And more particularly, you need a physical therapist who understands this disease, because physical therapy, like everything else, has gotten specialized. And so there are physical therapists for joints and for spines and for neurologic disorders. We need to help this person use their hands so they can feed themselves for as long as possible, and they can use the toilet and bathe and do things that we don't think about doing until we have a problem doing those things. And that's what we have occupational therapy for. Because of his speech difficulties, we have to be concerned about his ability to communicate. One of the most difficult things about this disease is when you lose the ability to speak and you're separated from your loved ones and your family and your friends because you can't communicate with them anymore. There are lots and lots of great devices as these symptoms get worse, as the disease progresses, to help with that. And that needs to be coordinated through a speech therapist who also needs to help with his swallowing symptoms and work with a dietitian to make sure that they're getting adequate nutrition so they have the strength to fight this for as long as possible. And then there's lots of just very practical issues that come up for people like this. So can he keep working? What does he do about disability? What does he do about life insurance? What does he do about long-term decisions? Maybe he's got home that he has to decide whether he can keep or not keep anymore. And these are really complex decisions, but for the person who receives that type of a diagnosis, in many ways, they are often the most significant decisions because they have to care about their loved ones and their family and make the best decisions for everyone. Again, these are really long conversations that are best done through a social worker. So one option is then to say, okay, we're going to refer you to these 6 places. We're going to hope that each of the places that you go to, that you see a physical therapist who knows something about ALS, or an occupational therapist, or a social worker that knows something about ALS. In most cases, the answer to those questions would be no. Instead, what we want to do is to bring all of that care into the Neuroscience Institute. We want to have all of those people in one place, so when this patient comes in, they're going to see everyone. It's going to be a long afternoon, but they're going to see everyone in one visit. It's hard to transport people if they have disabilities, so you don't want them making 6 different visits to people. You want it all in one place. And then most importantly, and one of the things we've really cultivated here at Honor in the last few years, is a large group of therapists that specialize in these types of diseases. So our therapists see ALS patients every week. Every week they're seeing multiple patients in our clinic, seeing these patients, and then they see the same patients over time to see if things are changing and what they can do. The family then gets to know the therapist. When they have questions at home, they don't have to call the doctor, who usually doesn't know the answer. They can call the therapist, who does know the answer. And then in our clinics, we have a nurse navigator. So a wonderful nurse who they can reach out to at any time. And that nurse gets to know the family, and then that nurse works with lots of state associations where people can go out to the patient's home and we can learn how are they functioning at home, because very often the patient comes in and you ask, well, how do you get to the toilet? How do you transfer? And they say, oh, it's no problem. But if you actually go into their home, you realize they can't do it, and it is a problem. And if we don't do something, they're going to fall and they're going to hurt themselves. And so that's the type of comprehensive care that we're talking about, that we deliver right now, but which we want to expand into other disease states. So we've been doing this for ALS for about 20 years. It's an unbelievable way to care for people. And if you go to the next slide, but now what we want to do is to say we can do this for all of the diseases that we face in neurology. Next slide, sorry. And so this would be another typical patient for us to see. So this is a 78-year-old female who's had 2 years of losing her memory. She's becoming more forgetful. Her family notices it. She's having a lot more difficulty. She gets lost occasionally, and it's been very concerning for the patient's family. So the patient came in, was evaluated here, and was diagnosed with Alzheimer's. Again, another terrible diagnosis, unbelievably common. The estimates are that 1 in 3 Americans by 2050, at the time of their death, will either have dementia, Parkinson's disease, or ALS. As the population ages, these diseases become much more common. And so finding the best ways to care for these people with dementia is unbelievably important. And unfortunately, what happens in many places in neurology is that once the neurologist makes the diagnosis, and again, we don't have very effective therapies for this right now, the patients are kind of sent out to fend for themselves, and the families have to fend for themselves, and there's so many questions. But even more than that, there are things that we can do. Again, even in dementia, there are ways that we can work with patients and their families to make their life better. So one of the first stops in that is getting a good assessment of what they're thinking, what their cognitive function is. And so we need neuropsychology in this clinic. We need to use what's called cognitive therapy. So a branch of speech therapy is actually to work with patients that have brain injury of any sort. It could be traumatic brain injury, it can be dementia, but there are cues, ways for us to teach the patient and their family to preserve their memory for as long as possible. It doesn't just have to be you have have dementia go home. No, we need to work with the patient and the family to show that there's an active role that we can have here. With dementia, falls is an enormous issue because people often don't think far enough in advance to know what to do with their next step, what not to trip over. And so working with physical therapy is really important. An unbelievably big issue with dementia is the driving question. And so again, we work with occupational therapy, often with simulation driving things that can be done on the computer to say, do we think that this person is still safe to drive, or do we need to get a driving evaluation, or do we need to just take away the license and save their life and other people's lives? That's often one of the biggest stresses for families, is trying to take away a driver's license from a person who clearly should not be driving. That needs to be our responsibility in the clinic as the healthcare providers to say this person isn't safe anymore. And then again, this, this question of trying to plan for the future, working with the social work team to say, okay, let's talk about are they going to be able to be home for one more year, or do we need to think about a nursing home for this person? And again, those are the huge concerns that families have. Those are the very, very difficult decisions that they have to make. And if we work with them over time, then when that time arises that they might have to make that decision, they have a team that they can trust and rely on and feel confident in their advice. And so that's sort of how we envision our dementia clinic. And then one more slide. And so this would be another, again, typical patient with Parkinson's disease. So they've had Parkinson's disease for 4 years. Early on, Parkinson's disease might just be a little tremor, or people might notice that their walking has gotten a little slower, but it doesn't necessarily have a major impact of their life. But unfortunately, Parkinson's disease gets worse with time. And so as it gets worse with time, we need to start to intervene and to do what we can to improve their level of function. So obviously, falls are an enormous issue and a big concern in Parkinson's disease. So we need physical therapy to evaluate their gait. If the patients have tremors in their hands, we need occupational therapy to help work on, again, those normal daily activities that we all take for granted, but when they don't work, become unbelievably frustrating for the patient and the family. One of the amazing things about people that have difficulty with their hands is that everyone has had this problem many, many, many times before. Some of those people have been engineers, and those engineers often design the most amazing little pieces of equipment that you would never even think of, but things that can help you eat or button a button or zipper a zipper that are like $5, but change your life. And there's a massive catalog that the occupational therapists have to show people all the different ways that we can help compensate for the difficulty that they might have. One of the other big concerns in Parkinson's disease is that as the motor function becomes affected, they don't swallow as effectively, and they can develop pneumonias because they put food into their lungs. And so we pay very close attention to that with speech therapy to be sure that we're doing everything we can to prevent aspiration pneumonias. And then likewise with the dietitian, because we know that nutrition in Parkinson's disease is very, very important, that if people with Parkinson's are losing weight, their disease progresses more quickly. Some percentage of patients with Parkinson's disease develop what's called Parkinson's disease dementia. And so again, having that neuropsychologist to do brief evaluations on everyone, and then if we do recognize that there are some problems, doing the more formal neuropsychological testing. And then again, that same future of, the future planning is so important. It causes so much anxiety for the patient and for the family. And it's just helpful to have somebody who's been through this so many times with other patients to say, okay, these are the options. This is something we need to think about soon, or we don't need to think about soon. But those types of questions can be answered, and we get a lot of those asked, in between clinic visits. So if you come into the clinic every 3 months, a month later, you're like, oh my gosh, what should I do about, X, Y, and Z? Well, then you just reach out to the social worker. It doesn't have to be going back into the whole clinic or seeing the doctor, because each team member is really providing that care. And again, we will have many more of these types of clinics, but these are just sort of an example. And the idea also, as you can see, is that we tailor each clinic with the appropriate staff based on the problems that that patient is having. So I don't think there's any more slides, but just go one more in case I missed something. Okay, yeah, so anyway, one more slide. So the real point is we unfortunately in neurology and neurosurgery, we do deal with many incurable diseases. So we don't have cures for Parkinson's, for dementia, for ALS, for many brain tumors. On the other hand, it doesn't mean that we can't help the patient and their family, and it doesn't mean that we can't care for the patient and their family. And so in a lot of ways, the learning that we do as clinicians that take care of the people is that we keep refining the things that we can do. New devices become available all the time, and we bring those into the clinic. We see what the patient's like, and we learn from the patient. And I think that's probably sort of my last sort of big take-home message is that there's really no one in the HonorHealth Neuroscience Institute, regardless of the disease that they have, that should ever feel that they don't have hope. Because science is advancing really quickly. Care can always be given. We can always improve quality of life, even with some of these terrible diseases. So I think I will stop there.
Wow.
That, I'm sure, is my last slide.
Well, thank you so much, Dr. Levine and Dr. Marciano and Kelly, for that very enlightening update. You know, one of the things that I take away is there is hope, and this institute is bringing hope to so many patients and families, and I can't thank you enough for doing that. Next slide, please. So, you know, as you can imagine, we are so eager here at HonorHealth and HonorHealth Foundation to bring this exceptional vision to our community and to bring this level of personalized care to families and to patients who need support. And philanthropy really is the critical piece that does bring all of this together. So on this slide, you'll just see some of the ways that our donors are making a difference. And many of you are on the WebEx. You know who you are. And I can't tell you how grateful we are to you for your investments. And for those of you who are here to learn and to learn a little bit more about this project, should you feel called to join us in transforming neuroscience care here in the state of Arizona and to help many of our most vulnerable patients, please do reach out to your contact here at the foundation or the main line listed in both your confirmation email and on the concluding slide. So with this, I will turn it over for some questions to Kelly, and it looks like we already have several questions in the queue. Remember to please submit your questions via the Q&A feature if you'd like to join our discussion. Kelly?
Hi there. Thank you, Ashley. So, Dr. Levine, the first question is for you. And I believe you answered these within it, but if you could go into a little bit more detail, what are the multidisciplinary clinics that'll be into the Neuroscience Institute?
Sure. So we've been doing these, again, for many years for some diseases, but the idea would be that the patient and their family would come into the clinic. The clinics are usually run for about a half a day. In that half a day, the patient goes into their room, and then every 30 to 45 minutes, a different team member would come into the room. So for example, if we think about the dementia clinic, the neuropsychologist might come in first and then evaluate the patient, and then they would leave, and then the physical therapist would come in, and then the occupational therapist, and then the dietitian, and the speech therapist, and then the doctor, and then the nurse. So it's a long afternoon, so it's not something people want to do every week, but what it does is in one visit sort of gets that complete assessment of everything that we need. The other big part of the Institute that I think Fred mentioned briefly, and I did not mention, but I should have, is that I think one of the things that really has driven us to think about this clinic, about this Institute, is the idea of being able to have doctors and therapists and neuropsychologists and everybody in one place to be able to talk to one another. Because again, as we talked about, healthcare has gotten very fragmented. When I started 25 years ago, you know, I would see doctors in the hospital, I'd pick up the phone and call other doctors. Now I almost never talk to another doctor. We're just too busy, and it's too hard to get in touch with people, and it's really sad. It's a terrible way to deliver healthcare. So in the Institute, all of the neurosurgeons and all of the neurologists and the neuroradiologists are on one floor. where we can talk to one another. We share a conference room where we can bug one another, hopefully have lunch together one another now and then. And it allows for that kind of interchange of ideas, and the same being true in the clinic. So at the end of the clinic, the doctor, say me, sits down with all of the therapists and the neuropsychologists and the dietitians, and we all talk about each patient, and we say, what can we do to help that patient? And then again, this whole idea of integration, we then send a letter to each patient that says, okay, the physical therapist said XYZ, the occupational therapist said this, the speech therapist said this. And the reason that's so important is that it's a lot of information to take in 3 to 4 hours for a patient or their family. And this then they get in the mail 2-3 days later, and it serves as a reminder to say, these are the things that I'm supposed to be doing. I'm supposed to be doing physical therapy for this. I'm supposed to be getting this x-ray, whatever it is. And all of that allows this kind of what we hope to be kind of seamless integration. And then as Fred mentioned, kind of to me, the cream of all of this is the nurse navigator. So then that nurse navigator is in that conference about each patient. And so when she comes back to the office the next day, she goes, this patient needs these 10 things, and this one needs 6 things. And they make sure that it gets done. And then the patient knows that's the one person I call to make sure that everything gets done. It's a way of, I think the Cancer Center has done that. I mean, Virginia Piper has done that because they've realized there's so much that occurs in cancer care that if you don't have somebody directing people while your head is so messed up with all the stuff that's going on, nothing really happens. And so that's sort of our concept of the multidisciplinary clinic.
Thank you, Dr. Levine. And while you're on that, can you also address one additional question around caregiver education and support programs for those caregivers?
Yep. So that is a very big piece of everything that Fred and I have been talking about. So again, number one, the clinics are designed so that the caregiver, the family is there. And so they are learning a lot during that clinic. If you need to learn how to, passively stretch a shoulder, then the therapist can teach the caregiver right then. So that the clinic is very much geared towards caregiver education. The second piece is that the first floor of the Neuroscience Institute is going to have a lot of these conference rooms that Fred mentioned. And we envision using those. My hope is that people think of the Neuroscience Institute sort of as a home, so that people aren't just going there to see the doctor. People are going there, let's say, at 6 o'clock to do chair aerobics, or they're going there at 7 o'clock for a course about dementia for caregivers or for patients and caregivers. And so we want a lot of educational stuff. If it doesn't end up being very active and community outreach and education, then we failed. But that is very much our vision for this, yes.
Thank you. Dr. Marciano, do we anticipate having out-of-state patients come here for our neuro and spine care?
Yes, I would certainly hope that that this vision will reach beyond our borders. Many of us take care of patients from other countries. Many of us take care of patients from other states. And we would anticipate that our level of care will inspire others to come. And so certainly we're welcoming anybody and everybody. I think the fact that we have such high caliber physicians who have international reputations is a draw in and of itself. But once we get them into our institute and we show them what we can do and our patient-centric care and the multidisciplinary clinics and the integration of all of the physicians and the support services, I think they'll find that it's going to be a destination center for the Southwest and hopefully a national destination center.
Kelly, I'm going to interrupt for one moment. It's Ashley. Dr. Lynn Crocker has asked to be unmuted for one moment. I think she'd like to ask a question verbally. Dr. Crocker, I will unmute you now.
Thank you so much. And thank you, Dr. Levine and Dr. Marciano, for this wonderful presentation this afternoon and all that are involved. It's really astounding, the team that you have put together and collaborated with. But I really think that there is one piece that is very, very important that was not addressed, and that's truly the integration of the emotional and spiritual aspect. And using therapeutics that are maybe perhaps more subtle in being able to truly give these patients some comfort as you mentioned, Todd, these are very long visits. They're seeing, multiple, they're either in therapy or they're having a clinical visit, which can really take a toll on someone. I think it would be very important to even incorporate perhaps whatever the meal during that time frame would be, and really teaching people a more, a healthier way to eat, as well as being able to maybe have some relaxed time in between their waits where they're not just waiting in a waiting room for their next therapy, maybe experiencing sound therapy or other energetic therapies that can be very, very helpful in actually giving people comfort. Because I really feel that people can be optimally well wherever they are on the continuum of life and wellness. And I believe that's true even at end of life. I've practiced as a hospitalist for 20 years, and actually Dr. Levine and I worked together for several years. I was the neuro ICU hospitalist at Banner Good Sam, and with our stroke program, and then also the first transitionalist physician actually with Banner Heart Hospital, and really understanding the entire continuum of care. But in my own practice, I have been practicing integrative medicine at the bedside in an acute care setting through many, many, many hours of my own education and certification in various subspecialties. And I think that would be a very important part, because there's also a lot of research being done on how efficacious some of these more subtle therapies are, especially to give people real comfort, and also something that they can take home with them outside of, physical therapy or occupational therapy. But how do we, feel better just in our own skin as we're going through these difficult times? And so it's very important, the behavioral and emotional health aspect, and definitely the spiritual care aspect, which is something that I like to bring into the bedside, no matter who I'm with. And so that would be something that I would, like to see, as we've sort of spoken about the hopeful future integration of the Center for Living Medicine that we had talked about with Dr. Gladys T. McGarry. I've also been a part of her Eagles group for many years, and several on the call as well. We've been collaborating together to that end.
No, I definitely agree. I mean, I think that looking for, I hate to use the word alternative, or non-traditional, but you sort of get the idea. Other ways to try to help folks is usually important. And then particularly, so we didn't really mention the other multidisciplinary clinics that we are going to be developing. So for example, we are having one for headache, where lifestyle modification is unbelievably important in improving people's headaches. And so again, I think each clinic will have a role for these types of therapies. And yeah, we definitely, Lynn and I have been talking, so we definitely would love to include that as well. Yeah.
Thank you.
Yeah, thanks.
If I could comment also, I think those are fabulous ideas. Recognize that this is, as Todd has said, this is a home for neurosciences. And we would expect that it would include emotional and psychological and all support services that you would expect from your own home. And we also love hearing suggestions like this. And we hope that all those that are on the call, and those who aren't on the call, who you might reach out to, give us your thoughts. How can we make it better? How has healthcare disappointed you? And what things can we do in this center that have been absent in your current or your past healthcare experiences? Because we want to make this our center. It's not mine, it's not Todd's, it's our center, and we can only make it that way with helpful suggestions like you just mentioned.
Yep.
Okay, I think we have time for one last question. Kelly?
Yeah, so there was an additional question around how to schedule a patient, or schedule yourself if you're being referred to see a neurologist or first care at HonorHealth. So there's multiple different ways to do that. So you can schedule an appointment through a single number for HonorHealth, and they'll get you to the right provider. Someone who's had previous care with HonorHealth can go online to a patient portal or through MyChart. So there's various avenues to be able to get in to see the correct provider. And that's part of our process, you know, be understanding what type of provider you need to see, what your symptoms are, and getting you to that right person. If you're talking about getting into HonorHealth neurology directly, absolutely. If you're calling that office, depending on your condition or concern, we can get you with a specialist that looks at that specific area and take it from there. That's part of our navigation process.
Okay, well, fantastic. So I think we will, with that, we'll wrap it up. I just wanted to once again thank you, Dr. Levine, Dr. Marciano, and Kelly Jackson for your incredible presentation this afternoon. And once again, on behalf of the new Honor Health Neuroscience Institute and Honor Health Foundation, I'd like to thank all of you who joined us on the WebEx today. Stay well, everyone. We miss you. And thank you. Thank you all for your generous support.